is actually made at home by hand washing, through nutrition. And hospitals and clinics are garages for repair when people are unwell.
What we've learned to prevent and respond to COVID should continue after the pandemic. As UNICEF, we'd like to continue working with the government and other partners to ensure that there's clean water, sanitation facilities, and we promote hygiene for our children.
Hand washing plays an essential role in reducing the transmission of outbreak-related pathogens such as cholera, Ebola, shigellosis, SARS, hepatitis E, and now COVID-19. And hand hygiene is protective against health-associated infections and reduces the spread of antimicrobial resistance.
Focusing on hand washing behavior change is the most important thing for us to do, and we've focused in that space strongly, touching nearly 4 million lives. We must not relent, despite some of the early signs of easing of the pandemic that we're seeing at this moment in time. If ever there was a time to double down in our behavior change, morals, and focusing on hand washing, it is now.
Almost a third of cases can be avoided by just hand washing. And indeed, we do believe it's the best way to remove germs, avoid getting sick, and prevent spread of germs to others. The benefits go beyond COVID-19. We've heard about the issue about diarrhea diseases, about respiratory infection, which is very clear in all the facilities you go to, and you talk to the doctors and the nurses, they'll tell you how the numbers have reduced in those facilities. So if we actually are able, as partners, to promote this to continue even beyond this season, we are going to really make a lot of gains. Together, I do believe we will be able to suppress this virus, and most importantly, we'll be able to improve the lives of Kenyans if we continue to really practice hand washing.
Billions of people around the world continue to lack access to clean water and soap. 70% of schools in developing countries also lack basic hand hygiene facilities. It is great that the government of Kenya, both at the national level and at county level, are investing in these facilities. More needs to be done. Organizations like UNICEF, PSI, others, it is fantastic that you're there to support the government implementing COVID guidelines and delivering the facilities that are needed for children and teachers to be able to wash their hands.
Already we are seeing a spike in Europe, in the US, there is a spike in Kenya too. But that doesn't mean we have to run for cover. That just means we have to reinforce the prevention aspect. And the first and most important one is hand washing. A very simple solution which has far-reaching positive consequences.
Hand washing should become our second nature and should be done frequently, because you never know when you come into contact with germs. The ministry is dedicated to ensure that our children receive basic hand washing facilities and are safe as they continue their education.
On this day, we continue to aim to raise the profile of hand hygiene as a topmost pillar in the control and prevention of the COVID-19 pandemic, as we continue to further raise awareness of its importance, and particularly building on how simple, effective, and affordable it is.
We've managed to get 1 billion people washing hands with all sorts of programs. You know, we're now a global brand, and I'm so proud of it. And I'm so proud again to see them leading with campaigns that are really changing the way we think. So H for hand washing is very simply because H shouldn't be for hat, but it should be for hand washing. So I'm going to invite you all to come with me so that we could actually practice this habit of hand washing.
Nimenawa.